Okay, sorry about doing it this way, but so that way I can get my lecture in while I'm gone today. So we're talking about blood groups today, blood types. You can see I'm at table 17.4, which goes over the ABO blood types. Humans actually have over 30 naturally occurring blood types, or RBC antigens. To throw the word antigen out there, you can see it's up here. Antigens are actually these proteins, and actually they're glycoproteins that you find on the surface of the red blood cell. And you can see here, this is AB blood type. The reason it's AB blood type is because it has both the A and the B antigens on the surface of the red blood cell. Down here we've got B-type blood, and we've got B antigens on the surface. A-type blood gives us the A antigens, and then O-type blood has neither A nor B antigens on the surface. Now, along with these surface proteins, you also have antibodies in the blood plasma, and so the blood protein, the antibodies are either going to be anti-A or anti-B antibodies. So you can see up here, this is my B-type blood here. It has anti-A antibodies. My A blood has anti-B antibodies. So in other words, back up here with my B, if my B antibodies come into contact with a B antigen on the cell surface, it's going to attack it. So that's why my AB up here has neither. There's no antibodies in the blood plasma, otherwise it'd attack itself. When I say attack it, it's either going to clump the blood up or it's going to rip the cells open, neither of which are a good thing. So, B-type blood has anti-A antibodies, A-type blood has anti-B antibodies. O-type blood, look, it doesn't have any cell surface proteins, so no antigens here, but it has both the A and the B antibodies. So it will attack both of them if it comes into contact with it. And of course then AB blood is not going to have either type because otherwise it's going to be attacking itself. Now there are other blood groups. There's M, N, Duffy, Kell. Those are just all for legalities, so we don't have to worry about those today. Okay, when it comes to the antigens and the antibodies, the goal is not to mix them because anytime you mix them, that's when you're going to have a problem. The problem that we have here is called hemolytic reaction. And again, that's where we're clumping or we're tearing cells apart. So that's what happens. Now, when it comes to RH, there's actually a series of RH. RH stands for rhesus, where they got it from the rhesus monkeys. Anyway, someone who is RH positive has another surface antigen as the RH antigen. If you're RH negative, it's not there at all. But here's the thing. If you're RH negative, you don't contain any antibodies for the RH. If you're RH positive, obviously you wouldn't want antibodies for the RH. But here's what happens. The antibodies to the RH can actually form. They can form in people. And we need to talk about that. When that happens, we're looking at hemolytic newborn disease. It's also called erythroblastosis fetalis. It's nasty. So in erythroblastosis fetalis, here's what happens. We have, I'm going to write it in the white first so we can see it. We have an RH negative mother. So she's not going to contain antibodies because she didn't have the cell surface, but she doesn't contain the antibodies. She gets pregnant from an RH positive father, and the baby then, 50-50 chance, but if the baby comes out RH positive, what happens is the baby's blood and the mother's blood will mix. It's during childbirth, you're going to have slight mixing. Well, now all of a sudden my mother here is RH negative. She's never been subjected to this protein before. So now that she's subjected to it, she becomes sensitized. In other words, she forms anti-RH antibodies. Not a problem at this point, because baby's born, baby's here is fine, not a problem. Mom now has anti-RH antibodies, not a problem, if the story ended there. The problem is, mom and dad decide to have baby 2. Well, mom's creating these antibodies. If baby 2 is Rh positive, these antibodies are going to attack this. They're going to attack the baby's blood for that Rh. And that will destroy those cells. And it's all because she's created the antibodies. So it's always the second, third, fourth, whatever. Child number 2 becomes the problem here. Again, child 1 is fine. Child number 1 is the part of the cause, but it's child 2 that mom can start to attack. So in this case, we do have a way to help with this. We give the drug, it's called RhoGAM. And then the other things that we're going to do is we're going to do transfusions to try to, they're exchange transfusions after birth to protect the baby. And again, this is just the baby we're doing this with. Okay, so that's hemolytic newborn disease. Okay, so we were talking before about the reactions. Some of the reactions, again, we can clump the blood cells, we can rupture the blood cells. Clumping, obviously, that's going to impede flow, so that's going to be a real problem. If we rupture them, we're releasing all of that hemoglobin into the bloodstream. That's a problem. So anyway, when we look at these transfusion reactions, we've got to be careful what takes place and what happens. Okay? So now, today's lab. Okay, sorry for the interruption. Let me show you about the lab for tomorrow. Well, lab today. You're going to have a series of trays. The trays, they're this big, by the way. But what they've got is they've got these wells in them. And you have a well that has A. You have this little well for B. And you've got a well here for RH. Okay. So what you're going to do is there's a whole bunch of blood back there. And the blood belongs to Mrs. Smith, Mr. Brown. There's a Green, Brown, Smith, Green, and Jones. 4 common names. Anyway, so what you're going to do is maybe we're going to look at Mr. Green's blood. You're going to take 3 or 4 drops and you're going to put them in each of the wells. Okay, and you only need, again, 3 or 4 drops on this. It doesn't take a lot. So then after that, you're going to find the anti-A serum that's back there. In the anti-A serum, you're going to mix it in here, put 3 or 4 drops in the A one. You're going to find the anti-B and put it in with the B in the B container. And then the anti-RH, sorry, didn't have the right color marker here. 3 or 4 drops in. Okay. Once you put the drops in, now you need to take a toothpick and smear these things together, mix them up. Please don't cross-contaminate one well to the next, so use clean toothpicks every time, or at least the back side of the toothpick. Once you've mixed these up, you're going to let them set for just a few minutes. What you're looking for then is which ones clump. Clumping means that they truly do clump, or they change colors, but they don't look like just the blood that you put in there. If they clump, it's there. So in other words, if this one up here clumps, that would be positive for A-type blood. If this one clumps and this one clumps, that's A positive. If all 3 of them clump, that's AB positive. Maybe the RH didn't clump, so now we have AB negative blood. Anyway, that's what you're looking for on this, is to get all of them to clump, or see which ones clump. And so I need a blood type then. So if this is the case and I clumped AB, Mr. Green then would have AB negative blood. That's how you do it. And so again, you're going to need 4 trays, 1 for each person. Actually, you can just get 1 tray and use it for each person. Just make sure you clean it every time. The important thing is that we use clean toothpicks, and I'll make sure that we've got clean toothpicks back there. And you work through the lab that way. Now, if you have time, there's a part of the lab that's going to ask you to go through and look at the blood, one of the drops of blood under the microscope. So, what you do on that one, this is a pretty straightforward one. Microscope slide, drops of blood, usually 1 is plenty for this case. And then on top of that, you need to put a cover slip. It'll flatten out. Look at it under the microscope. I cannot stress enough how small the little dots are you're going to be looking at for this. There are going to be tiny, tiny, tiny little red dots under the microscope. There'll also be some blue ones, but they're going to be really hard for you to see. So, spend some time looking for these things, and they're going to ask you to do a count in the lab, and the lab explains all this. Okay, they want you to count how many red dots are there, and so they're trying to get a count of red versus blue. And again, the lab explains this all. So when I come back on Monday, what I'm going to want to know for sure is what are the blood types for the 4 people. And then if we need to finish this part on Monday, I'll be happy to be here and I will help you with that. And hopefully you understand this video and what I'm trying to get you to do. I think that's all I've got. I will see you all Monday.